A stroke is a serious medical condition that can cause permanent damage or even be fatal. But what exactly leads to a stroke? While it's natural to be alarmed by the reemergence of certain health threats, it's important to recognize the progress we've made in many areas thanks to medical advancements and public health education. For instance, reduced smoking rates have contributed to a decline in lung cancer cases. Similarly, widespread COVID-19 vaccinations have significantly lowered severe case rates. Stroke, despite still being the 5th leading cause of death in the United States, is another area where we've seen notable improvement. According to the U.S. Centers for Disease Control and Prevention, stroke-related deaths in the country have declined. This positive trend is largely credited to better management of key risk factors like high blood pressure and high cholesterol. However, the battle is far from over. Someone in the U.S. dies from a stroke approximately every 3 minutes. Here's a closer look at what strokes are, what causes them, and how they are treated. Strokes occur when the brain's blood supply is interrupted, depriving it of oxygen and nutrients. There are 2 main types: ischemic stroke. The most common type, occurring when blood flow to the brain is blocked by a clot or narrowed arteries. Hemorrhagic stroke, caused by bleeding in or around the brain due to a ruptured or leaking blood vessel, which can create pressure and damage brain tissue. Ischemic strokes make up about 85% of cases, while hemorrhagic strokes account for around 15%, notes Dr. Lawrence Wechsler, a neurology professor at the University of Pittsburgh. An ischemic stroke often results from blockages in the blood vessels. These can stem from plaque buildup, fatty deposits, clots formed in the heart, or narrowing of the arteries. In contrast, hemorrhagic strokes may be brought on by high blood pressure, head injuries, aneurysms, weak spots in blood vessel walls, and other vascular abnormalities. A vascular neurologist with Atlantic Health System explains that many of these risk factors are either preventable or manageable. Common modifiable risks include obesity, smoking, excessive alcohol consumption, and lack of physical activity. Certain medical conditions also raise stroke risk, including type 2 diabetes, sleep apnea, high cholesterol, high blood pressure, and atrial fibrillation, and irregular heartbeat. Even though age and genetics can play a role, factors beyond our control, many lifestyle-related risks can be significantly reduced with appropriate changes and medical oversight. Spotting the signs, the F.A.S.T. test. Rapid response is essential when a stroke strikes. Recognizing the symptoms early can save lives and minimize long-term damage. The American Stroke Association recommends using the F.A.S.T. acronym F, face drooping. Ask the person to smile. Is one side uneven? A, arm weakness. Ask them to raise both arms. Does one arm drift down or feel numb? S, speech difficulties. Are their words slurred or hard to understand? T, time to call 911. Act fast. Emergency treatment is critical. How are strokes treated? Stroke treatment depends on the type and severity. Ischemic strokes may be treated with medication like TPA, which dissolves clots, or through surgical procedures using a catheter to remove the blockage. Hemorrhagic strokes typically require neurosurgical intervention to repair damaged blood vessels and relieve pressure on the brain. After immediate treatment, patients may be prescribed medications to prevent future strokes, such as blood thinners or antiplatelet drugs. Long-term management includes controlling blood pressure and cardiovascular health. Rehabilitation is a key part of recovery, and often includes a mix of physical therapy, medication, and lifestyle adjustments. Each recovery plan is personalized, says Dr. Thatchell, depending on the severity of the brain injury and the individual's overall health. While strokes remain a serious threat, the good news is that awareness, prevention, and medical progress are helping to reduce their impact. With the right lifestyle choices and quick action in emergencies, the odds of surviving and recovering from a stroke continue to improve. Please like and subscribe for more health facts.